members of the Japanese Association of New Economy, ladies and gentlemen. I am Dr. Wei-Chang Li from the Taipei Venture General Hospital, Taiwan. It's my greatest honor to have this opportunity sharing Taiwan's experience in response to the COVID-19 epidemic. And so at the beginning of the epidemic, my alma mater, the Johns Hopkins University, predict that Taiwan will have the second highest number of infected cases and deaths in the world because Taiwan is so close to China and with very close communication. It was a bold estimation based on many scientific statistics and Taiwan's past performance in SARS outbreak in 2003. But they are wrong. Up to August 22nd, the infected cases were 487 in Taiwan, since the first case imported from China on January 21st. The number of deaths keeps at 7 after May 11. Obviously, there are two waves in Japan, and you can see from the slide. We just passed over the peak of the second wave. Now, the daily new case in Japan is around 1,000, as I read from the NHK media. And the trend has been continuously going down over the past 2 weeks in Japan. Taiwan's performance has been widely recognized by many countries, including Japan. Here is the one recent analysis published on the Newsweek Japan, revealed that Taiwan ranks #1, given the relatively fewer infection cases and the smaller economic damage than the other countries. Here I would like to quote one Chinese old saying, that's born at hardship and die of happiness. Actually, for the past 20 years, Taiwan experienced so many infectious disease in epidemics. So we continue to fight the virus and the infections and almost every year. So that's the reason we accumulate a lot of experience this time. And we have experienced the SARS, H1N1, H5N1, and the other like dengue fevers almost every year or every other year. So we have prepared for the emerging epidemics for 17 years with accumulating experiences. This slide, you can see Taiwan, the painful experience in 2003. In that year, there were totally about 346 infected cases for SARS, and 73 were died. Many of them are doctors, nurses, and healthcare workers in SARS. That's a tragedy for Taiwan. And fortunately, it's lucky for Japan because there's zero infection during that time. And this time you can see Taiwan totally we have 487 infected cases and with 7 deaths. And in the world, it's more than 23 million infected cases and more than 300,000 deaths in the world. No doubt, the SARS epidemic was a wake-up call for Taiwanese and our government. At the peak of SARS infection, you can see the right side of the slide. One large city hospital in Taipei was locked down, and followed by many other hospitals. It has never been happened before. So the public fell into panic, and the whole society became chaotic. However, we drew the right lessons from SARS with a comprehensive review of our system and the fundamental reorganization plan after SARS immediately. So on the left side, I wrote an editorial on the medical journal to review this history. So the following, I would like to brief how Taiwan government, our medical care system, and our community to make a more robust mechanism in responding to the emerging infections after SARS. The first is about the government effort. We are both Japan and Taiwan are democracy countries. So the government administration should be based on law. That is people's empowerment. After SARS, the government amended the Communicable Disease Control Act. This is a foundation for organization reform. Taiwan CDC, the Center for Disease Control, or CDC, was thus enhanced by improving its facilities and equipment. And the CDC recruit more manpower, including 30 infection doctors. It's very rare, even in the United States, very few doctors involved in the CDC. And the CDC also introduced high technology for disease surveillance around the country, and I will elaborate later. Moreover, CDC also collaborate with the National Health Insurance Administration, or the NHIA, to establish a real-time disease surveillance system based on population's electronic medical record. In Taiwan, we have a universal health coverage like Japan since 1995, and everyone has a smart card. We call the national insurance card. You can see the table on the screen. I have the smart card, and there is a chip on there like our credit card. So the recent medical record will be recorded on the chip, and will be uploaded to the medical cloud. So all the 23 million people have a uniform database on the cloud. So they can link together, and they can also link to the custom and immigration data. It was very useful this time for the COVID-19 control. Actually, the most important is the law also empower the government to set up a central epidemic command system, or the CECC. There was no such a system during the SARS outbreak. So the commanding system was a chaos, especially between the central government and the local government. The executive yuan, like the Prime Minister of Japan, assigned the Minister of Health and Welfare to be the commanding officer, with the purpose of unified command, supervise and coordinate government and organizations' efforts at every different various levels. So that's our painful experience during SARS. The commanding system was not good at that time. The CECC is empowered by the amended law and activated by the law as needed. There are several missions. First is to formulate the policy and the plans for the prevention and the control of the communicable disease, including many things you can refer to the slide. And second is to supervise and to command and guide the local government for their effort. That's based on our previous painful experience. And also to establish a relief fund, just in case there are some victims due to the vaccine or the other activities. Like there are many medical workers, if they will die for the caring patient, they will get a relief fund in reward for their sacrifice. And to conduct the quarantines for the international and the airport and harbor, just empower them to have the authority to do that and to organize the international collaboration. This is when the SARS slammed Taiwan in 2003. There are some private hospitals reject to care patients during that time. So the amended law empowered the CECC to establish a communicable disease control medical network around the country. And all the hospitals, primary care clinics, and the medical personnel shall be participated to the network. No one can reject. Otherwise, hospitals or doctors will be fined or to be suspended for their practice or license, as by law. And the order has been the highest authority. As for example, all the medical personnel in Taiwan have been under the travel restriction by the CECC since January 23. So I cannot go abroad after February 23 up to today. So if the chairman, you invite me to Japan tomorrow, sorry, I wish to go to Japan later because I am under the travel restriction, not only for me, but for all the medical doctors and nurses in Taiwan. That's by law and also ordered by the CECC. So the CECC will also coordinate the inter-ministry affairs during the public affairs crisis. The representative of ministries, as it is on the slide, have the obligation to face the public during the press conference and to express their policies they plan to do. As you know, like Japan, our media and our people will review their performance and make a very severe critique if they were not doing a good job. The medical system also has been radically reformed in the preparedness of emerging infection after SARS. As I mentioned, there were many doctors and nurses died due to the nosocomial infection in SARS. So based on this painful experience, we also did some reform. First, the government, every hospital need to have a contingency plan for any emerging communicable disease, not only for COVID-19, but also for the flu and the other like dengue fevers. And the hospital need to establish an infection control team by the infection specialist at every hospital. And hospital also need to prepare a triage system and the fever screening station out of the main building. Because if any infected case enter the main building, the whole hospital maybe got infections and will be shut down. That's the experience by SARS. And also we need to separate the patient flow between infected and non-infected patient, because hospital will take care not only the infection patient, but also the other severely ill patient. And the most important, all hospitals need to maintain enough protective equipment like masks, gloves, and ventilators for 30 days, just in case there are no more stockpile from the other countries, because many protective equipment should be imported from the other countries. But during the urgent state, I don't think that this equipment will be get as soon as possible. So we need to keep the stockpile for 30 days. And also, hospitals need to have a drill for the infection disease every year, and under the supervision of the local healthcare authorities and the infection doctors. And because in Taiwan, all hospitals need to be accredited by the Joint Commission of Taiwan. I was the former CEO of the Joint Commission of Taiwan, just like the Joint Commission of the United States and the JQ in Japan. Hospitals need to be accredited, and the infection control is the most important chapter of the accreditation. So as far as all the students need to learn how to keep the good hygiene since elementary school. Given the past experience of SARS and the other infectious disease or air pollution, people have the culture of wearing masks and washing hands when necessary, especially in the crowd. I believe that the experience of SARS is critically important to many adults like me. And it is important to deliver this sense of urgency to the younger generation and to enforce the social cohesion and solidarity, that everyone has the responsibility to protect themselves and to protect others. I think that's the very important idea. We need to talk to the younger generation. So when the COVID-19 happened, I believe that Taiwan established a robust response mechanism for the emerging epidemic and activate it as early, quickly, and efficiently as possible. On January 20, the CECC was activated by law, and also by the former Vice President, Dr. Chen. He is an internationally well-known public health expert, and also led by the Minister of the Ministry of Health and Welfare. Dr. Chen is a command officer of the CECC. And so all the other ministries and the experts are ready to go on January 20. This is our quick response. The government took a very quick response and early deployment. Border control, I believe, is the most important strategy at the beginning of the epidemic. So among all the 487 infected cases, more than 80% of them were from the other countries, not from Taiwan. With the help of the technology, the government took precision testing and the strict quarantine strategies for the suspect case. And thanks for the trust between the government and the people, these restrictions didn't get too many resistance or complaint. But the major critique from people was hard to get the facial mask. I heard the same story in Japan. you can see the photo. Many people need to queue in line to buy the mask in Taiwan at the beginning of the epidemic. So the government announced to ban the mask in the PPE export in January, and to launch domestic mass production to recruit all the domestic factory to make the medical mask, and to setting the price for each mask of the US dollar 0.13. So no one can raise the price. So everyone can get the same price. And we initiate a name-based registration system. And so as you can see on the slide, the people can purchase the mask at the pharmacy store or 7-Eleven convenience stores. And the number of the number on this we call the facial mask map. You can check it online. Represent the reserved mask available to buy at the 7-Eleven convenience store or the pharmacy store. So people they feel much more comfortable and less anxiety because they know they can get their enough mask at a scheduled time. Maybe not today, maybe tomorrow, but I know that I can get a mask next week and from these pharmacy stores. And today in Taipei City, people can use the NHI smart card, like the smart card. I can use to buy the mask on the vendor machine. Taiwan also launched universal coverage in 1995. So as I mentioned earlier, everyone holds the smart card. And this time, this play a very important role in our infection control. So the National Health Insurance smart card and the claim data will link to the immigration and the custom database. As I mentioned, more than 80% of the cases are from the other countries and very few in Taiwan. So the strategy is how to keep safe of our national border. So for anyone who comes from the other country, their data will be a record on the card. So doctors and any government officers can use the machine to track anyone, the travel history, and their occupation record, like I'm the doctor, I'm the risk group. My data will be registered on the card. If I contact any infected patient, the contact history will be also recorded. In some area, like some concert or the gym, if the area has anyone have the infection, so if I was in that place, we call the clustering experience, will also be recorded on the chip. So from the chip, everyone can be tracked his TOCC, which means travel history, occupation, contact history, and the clustering experience, all are on the card. And so for all the people from the other countries, we also set up an intelligent electronic fence system. And so when I was come here, I will be given a piece of paper and I will leave my cell phone, and it will be tracked by this system. This is a GPS-based information system. So if I was supposed to be stayed home for quarantine for 14 days, if I leave my home, the message will send to the office, and I will be called by the policeman and also by someone who is in charge to see me. So no one will, otherwise if I found them, I go to the other areas, breaking the rule, I will be fined a large money. It's also important to be transparent to the public. As I mentioned, every day, the CECC will hold a daily press conference at 2 p.m. And the commander and the other experts, or the representative of the other ministry will explain their policy and report the media's questions. And also not only the traditional media, they also adopt the social media like Line. Line is the most popular one in Taiwan. Facebook, Instagram, WeChat, Google, and the other social media, because they are very important to the young generation. The young generation will not see the TV. They only use the social media. But this important message is need to deliver to the young generation. The goal is to minimize the public anxiety. Everyone knows government has the strategy and the next strategy in the future. This is we call the chatbot. This is based on the Line. And so this is for young, and I also got the information from this assistant every day. And this is very transparent to every citizens. And for hospitals, we have also took very quick response to the epidemic. I have written an article and translated to Japanese and shared with my friend in Japan how hospitals to quickly respond to the COVID-19 in early February. I think the principles for hospitals are the following. First, the goal infection control is to prevent the nosocomial infection or cluster infection occurred in order to keep enough medical capacity to treat the other severely ill patient. Because in Taiwan, we have only more than 400 patients. More patients, they have other severe disease, and the hospital need to keep enough capacity for them. And the second, the patient with the COVID-19 will be cared at the negative pressure and isolation ward in a dependent building. And this is very important. If they are treated in the main building, and then maybe if any case in the main building, all the main building maybe will be shut down. That's the strategy in SARS. So we will avoid to happen again in Taiwan. Third, the medical workforce caring for the COVID-19 patient will not take care of the other patient. We call the separation, and to keep safe for the other medical personnel and the patient. And the final is most important, all the equipment and devices are also separated from the infected and non-infected patient. This is my hospital, the largest government hospital in Taiwan, in North Taipei City. In the red line, you can see we limited the infected patient in a certain wards in hospital, it's different to the main building in the middle. And for the yellow line is for the flow for the outpatient. If they were infected, will be transported to the infected ward. They will not go into the main building. They're still out of the building. And for the orange line is for our emergency patient will also be transported in an independent line. We also establish a command center within the hospital. That's the information system. As you can see, and we will check the outpatient and inpatient volume and the flow and the waiting list at the emergency room. This is not only for the COVID-19, but also for the daily routine. But for the COVID-19 patient, we will check their admission and their discharge, and how many bed utilization and occupancy rate. The most important is the stockpile for the protective equipment and others. And the manpowers in the most severe stage in February and in March, some medical personnel were divided by two teams, A team and the B team. They will not cross each other, just in case one or two infected cases will not let the whole hospitals cannot work properly. We also need to follow the financial status, because many hospitals, when people are there, cannot go to the hospital, they worry about the infection. So the hospital service volume decreased 20 to 30% as a daily routine. All that you can see from the slide, even for the frontline clerk, they also need to be well protected. Our principle is we need to protect yourself first and then protect the others. And putting into the TOCC check history, all the employees need to check their temperature every day, and they also be banned for going abroad. For hospital, we also adopt many ICT in our containment, and we set up many APP for the visitor control, and we launched a telemedicine for quarantine the patient. I will elaborate more later. As you can see, every day we will visit about 7,000 to 8,000 outpatient a day. So for such a huge flow, I set up an outdoor checkpoint for their temperature and their TOCC by checking their smart card. You can see the flow during I think this event in February and in March. I think it's very hard for them, especially for the elders, because they need to wait in a queue. And then later on, we exchange. They don't need to in a queue. They just register online. we designed an app, so everyone, even for the elders, they can use a very simple way to register their visitor or their patient, if their family will stay in hospital, and they can register online. And the government only allow two visitors for each patient a day. So if you are the third one, sorry, you need to come to the hospital tomorrow. That's our limitation. So everything will be under the control and registered on the app. So we keep the order. And also, I think this is also very important change for the hospital, because like in Japan, it's our tradition. When my family was admitted, I need to take care of them in the bedside. But during the infection state period, it's not good for them. We also launched the telemedicine to our patient if they were quarantined at home. It's very convenient for them. I think the key factors are the self-disciplined citizens and with good hygiene, both in Taipei and Tokyo. I think everyone in these two countries, people that are willing to wear mask and keep good hygiene and keep social distance. I think that's the key success factor. I think in the near future, I saw from some new media, the Japanese also relieved your state of emergency after May 25, and you launched the new normal life since August 1st. And also you are promoting the Go To Travel campaign. And I saw from the media of Taiwan. But I think the important is that we need to learn from the past experience, just like our experience from SARS. And what this experience in COVID-19, Taiwan can share to Japan. I would like to summarize in the next two slides. The first is that we need to draw the right lesson from the past experience, and we need to improve it soon, because we never know when the next disease will come here, will come to either Japan or Taiwan. So we need to improve it soon if we think they still have some drawbacks. Second, we need to amend the law or regulations for quick response and efficient management at the national level. Third, we need to establish, I will recommend to establish an ad hoc central command system and activate it as necessary. That would be very good to unify the order between central and local government and at a different level of the ministries. And to recruit the experts and the specialists to infection team as early as possible. Fifth is to coordinate among different ministries and between the central and the regional healthcare authorities. Even today, we still see some conflict between the central and the local government because given the different background, some local government have their own strategies. But if they are different to the central policy, sometimes will create a chaos. And finally, is to maximize the transparency and thereby to minimize the public anxiety. And finally, I would like to share the other point is that we need to respond to emerging epidemic in an innovative and a creative way. Actually, I cannot imagine 17 years ago, during the SARS, we don't have a cell phone, we don't have AP, we don't have the social media. At that time, we rely on the traditional media and then some traditional way. But this time, we recruit so many talented people. They join the infection team voluntarily and create a lot of small technology. But it's very useful. Buying mask, waiting mask, or to controlling the gloves. It's very useful and very happy, especially for the young generation. We also need to enhance the health information technology and integrate it with the strong healthcare infrastructure. I think we already started to do that for more than 10 years, and we will update our smart card next time. Where we will use we call the virtual card, and so maybe we don't need any list card anymore, but all the information will be on the cloud in a few years. And to adopt ICT into infection containment, I think is very, very important, and to keep safe, to save time, and to improve efficiency. And for the people, we need to enforce the social cohesion and the government citizen trust. And because there are so many restriction strategies will hurt the personal privacy and we call the human right. So if the trust is not enough between government and the citizen, many strategies cannot be well organized, cannot be done. And also to foster the public sense of urgency. I saw some the media. They are in Western countries. There are many people. They still go abroad, breaking the rule of the quarantine or isolation. So you can see the situation in this country was still very bad. I think that's very important. We need to educate and advocate our public using the traditional and using the new media. Finally, I think the healthcare workers are very hardworking, and we need to protect and reward them. Yesterday, I saw there are some news about Korea. There are some strikes of the Korean medical doctors because they didn't get enough support. And finally, we need to support hospital with sufficient protect equipment. And there are many experts say that we will live together with the COVID-19 for a couple of years. Well, that's a bad news for all of us. So maybe we need a new normal life. But actually, there are the question for both Japan and Taiwan, how to make keep the balance between the efficient containment and economic prosperity. It's a very difficult choice and trade-off. And how to keep the balance between the perseverance for inflation and to also without at the expense of the human right and the privacy. That's a continual learning lessons. And I and my family plan to visit Tokyo to join the Olympic Games in late July. And you can see I have booked the baseball, basketball, and the table tennis. That's my favorite. Sorry, maybe I need to expect to see you and to visit Japan in 2021. I wish the Olympic Games can continue next year because I have visited Japan several times, including my honeymoon to the Hokkaido. And so I wish I can visit Japan soon. And thank you for your attention and comment. And thank you.